is presenting today stroke. We will address 5 questions as usual. We have to know the definition, the causes, the diagnosis, the complications, and the treatment. But for part 1, we are going to talk about the definition. We need to understand what is stroke. Stroke affects the brain. If we observe the brain, it has different parts. So we have 6 lobes. There is a frontal lobe, parietal, temporal, and occipital. Parietal is left and right, temporal left and right. And they are nerves, they are neurons that are in the brain that facilitate the whole function. And there are many vessels in the brain. Now, the brain has many layers that are covering it. From the head, where the hair is, there is a skin. Under the skin, there is connective tissue. Then there is what we call periosteum, a membrane that covers the bone. Then there is the bone. Under the bone, there is what we call dura mater, a very hard membrane covering the brain. Then under the dura, there is what we call arachnoid. Arachnoid matter. Under there is what we call P matter. Then underneath there is what we call brain, gray matter and white matter. These are the layers that are covering the brain. The brain is very well covered. It is well protected. You need to remember that on the brain there is a map. There is a map of the whole body. Each part of the body is represented on the brain. That's what we call homunculus. If there is a part which controls the sensation, there is a part that controls the movements. Anything that would come maybe and compress or derange this area, it will affect the sensation of this limb, because this is a part that controls this limb. Anything that would come and derange maybe this area, let's say this one, because this part is controlling the leg, it means there will be a problem of movement of that leg. So what is stroke? Stroke is a clinical syndrome characterized by rapidly developing signs of focal or global disturbance of cerebral function. Symptoms can last for 24 hours or longer, and this may lead to death if there is no treatment or if it becomes very severe. More recently, the term brain attack has come into use in the emergency stroke. Brain attack is similar to what we call heart attack. They have some similarities. Heart attack is what we call myocardial infarction. A transient ischemic attack, it's a sudden neurological deficit. Okay, it is presumed to be a vascular origin. Most of times it lasts less than what? 24 hours. So stroke occurs when there is a disruption of blood flow in the area, any area of blood. So this disruption of blood flow can be caused by, there are 2 things. 1, ischemia. 2, hemorrhage. What is ischemia? It's like an obstruction of blood flow that will lead to lack of oxygen, then it can lead to what? To necrosis. Now, hemorrhage is what? Is rupture of the vessel, which will lead to bleeding. Hemorrhage is bleeding. So the person will bleed in the brain. This is a good picture illustrating the 2 conditions, hemorrhage and ischemia. You see, this vessel was ruptured, then eventually the bleeding started in the brain. While ischemia, there is a clot that came from far, probably from the leg, from the heart. As it blocks here, then there will be ischemic stroke, and the whole area will suffer because there is no blood flow. Now, if the bleeding takes place under this membrane, we saw that this is arachnoid. The bleeding will be under this membrane. We call it subarachnoid hemorrhage. Most of times it can be sudden and it will compress the brain, then it will come with some complication. Subarachnoid hemorrhage is a bleeding between these two. This is a P mater, these two, P mater and arachnoid. You can see the vessels in between. Another cause is the time a patient has what we call atherosclerosis. Atherosclerosis, though it's a spontaneous intracerebral hemorrhage, mostly resulting from hypertension. Hypertension or atherosclerosis, it's atheroma or fat, if I may call it. It may be also due to rupture of arteriovenous malformation, which means if you have vessels which are malformed, if you can see here, these vessels are well organized. They are well organized, the arteries, and they interchange blood with what? Veins, with these capillaries. They are well organized. But when you see here, there is what we call malformation, arteriovenous malformation. This can lead to what? To stroke. Now, there is what we call subdural hematoma. This hematoma, the sudden eruption, okay, of any intracerebral hemorrhage, any, can destroy and displaces the brain tissue, which can lead to what we call intracerebral pressure. Okay, there is a lot of pressure pushing the brain downwards. Okay, so large hematoma will increase the pressure. Then increase of the pressure will cause vascular occlusion, you know, the vessels which underneath. Then ischemic injury, neurons, which will lead to cytotoxicity. The cells will start dying because the toxins are now being produced because of what? Of the compression, there is edema, and all the complications. Now, if we talk about now these types, we saw that there is what? Ischemic stroke, and we saw that there is hemorrhagic stroke. Ischemic stroke has what we call thrombotic or embolic. Now, in embol, it's this clot embolus coming from far, then it will come and block. You can see that it blocked this area. Then hemorrhagic, it can be primary, intracerebral, inside the brain inside, or subarachnoid, under the membrane that we saw. Okay? Now, there are some facts that we need to remember about stroke. Stroke is an increasing public health concern through the world. Stroke are the leading cause of what? Of serious long-term disability. Okay? And it is among the 10 leading causes of death. That's why it is among our priorities. That's why we need to talk about it, know how to diagnose it, treat it, and prevent it. So the World Health Organization tells us that 15 million people suffer a stroke worldwide each year. 15 million, which will result in 5 million deaths. And it results as well in 5 million people permanently disabled. So, advanced age is one of the most significant stroke risk factor. 95% of stroke will occur in people aged above 45 years. 2/3, let's say 60-65% of stroke occur in those over 65 years. Stroke can occur at any age, including fetuses, the baby. As long as there is malformation in the brain, in the vessels, it can also result in what? In a stroke. Men are more likely to suffer strokes than women, while more incidences of deaths from stroke occur in women. We need to study the causes behind. Other facts: the brain does need sugar to function. Glucose is very important for the brain. The brain is an obligate consumer of oxygen. Without oxygen, the brain will die. The brain is the most metabolically active organ in the body. When we talk about metabolism, we are talking about taking nutrients, proteins, vitamins, and cut them into pieces that the body will need to use, and eventually being also able to build them again in the component that the body needs. Catabolism, anabolism, that is metabolism. Okay? It requires 15 to 20% of total resting cardiac output to provide the necessary glucose and oxygen for what? For its metabolism. For the brain to function well, to do the activities that it's supposed to do, it needs 15 to 20% of cardiac output. The blood needs to reach the brain. Following acute stroke, cerebral autoregulation is lost. Okay? If there is a stroke, the autoregulation will be cut. And now what will happen? Adequate cerebral perfusion will be disrupted because it depends on what? On MAP, what we call mean arterial pressure. We need enough pressure, blood reaching the brain. Ischemic stroke due to occlusion and the reduction of cerebral blood flow can lead to cessation of electrical activity. When we talk about the nervous system, we talk about electrical activity of the brain. There is a lot of electricity going on in the brain continuously. If anything blocks that electricity, then that part will die. And the part that is controlled by that cerebral, that brain part, will have consequences as well. Okay, so we'll continue with health education, health promotion. We are inviting you to part 2, where we are going to see in details, a little bit in details, on causes and diagnosis, how we diagnose it and how we manage it. All right, thank you so much.